بالنسبة لل ASD طبعا تعرفوا إنه نحن نستعمل DSM-5 حل diagnostic criteria، وآخر update كان حاله في مارس أظن من هذه السنة. طبعا there are different criteria. There are criteria in communication, there are criteria in speech. ممكن بعدين حتى أبعث لكم اللينك وتشوفوا كل هذه الأمور. The most important thing as an occupational therapist perspective إنه الحين there is sensory processing disorder أو sensory sensitivities، وأيضاً في اللي هي restrictive behaviors. يعني تعرفوا إنه الautism is a spectrum as well، معناته إنه في mild to severe، والsymptoms really differ based on the client that you're meeting. So you can get someone with speech regression اللي هم يبدأوا speech وبعدين they start losing it after the first year أو first year and a half، وممكن حد يكون completely verbal، وممكن البيشنت اللي يكون verbal يكون عنده sensory hypersensitivity. ممكن يجيكم patient who is non-verbal with extreme hypersensitivity tactile و hypersensitivity oral. فit's a very mixed هذا very mixed يعني it's not very high. بعدين عندكم في ال restrictive behavior في عدة أشياء. ففي مثلا في mannerism. أوكي فمثلا يعني repetitive behavior are in a certain manner. بعدين عندكم اللي هو stimming، عندكم hand flapping، عندكم body rocking، body tensing. مرات a lot of patients we notice إنه حتى الجوز مالهم so clenched يعني. There are so many symptoms بس what they share in commonality إنه كلهم يعني under DSM-5 they are organized. Yeah, so in general يعني with mild ASD, you'd get patients who are usually more verbal. However, you definitely see some communication problem. Again, you might get patients who do not talk at all, do not talk unless it's really necessary. يعني مثلا خلاص جوعان حده ماما أكل و that's it. Or you get patients who are very talkative and they talk out of context. يعني مثل الحين إحنا جالسين نحكي في presentation he'll talk about dinosaurs but he'll jump topics and only talk within topics of interest and really struggle to engage in the يعني هذا topic. Yeah. With mild autism, again generally أصلاً مع autism you get higher comorbidities in multiple areas. You get comorbidities. You get comorbidity of fear, high risk of anxiety, high risk of depression, and high risk of ADHD. In addition to high risk of irritable bowel syndrome اللي هو يمكن تعرفوا القولون العصبي الحساس اللي either diarrhea or constipation dominant. There was actually one very recent study that they discovered that because of selective eating in children on the spectrum, the gut microbe is less diverse, which causes loose stools. So this was a very evidence-based, very nice study. فإيش اللي يصير إنه أصلاً the mild أو children with mild autism أو حتى adolescents, the chance of anxiety and depression معهم is higher, much higher than moderate and severe autism. ليش؟ لأنه they are more aware of the environment. وطبعاً ذكرت feeding selectivity. الحين feeding selectivity is also very very common with children on the spectrum. Feeding is part of the sensory processing, and the studies show that 90% of children with ASD have some feeding selectivity. Feeding selectivity بعد تجي بأشكالها وأنواعها و it differs person to person. ما أني شفت أي research يراوي أنه المايلد أو المودريت أو هذا أقل أو أكثر، بس in general يعني you can get children who eat very limited things. مرات they choose all whites مثلا خبز عيش banana، هاي الأشياء اللي they're mostly starch mostly sweet. Sometimes you get children who refuse sweets at all يعني ما يأكلوا فواكه أبدا it's only vegetables. Sometimes you get all kind of combinations. بعدين مع المودريت والسيفير again you see more stereotypical behavior. Sometimes you see more resistance to يعني إذا يكون unstructured, they really want their routine, and they establish their own routines. مثلا بيمشي بيدق راسه بيرجع، أو مثلا بيدخل شيء بيطلعه بيطلع and they just keep doing it. We get children who sensory they love looking at the wheels of the cars. But the interests are so varied, they're so wide. It's not يعني one specific thing يعني, as you both know already. I think the most common one we get is hyperactivity.
Okay.
So they're very active, they're climbing on the furniture, they're jumping off the furniture, they're all over the place. فاللي يصير أصلاً يعني if we consider that 90% of the children on the spectrum have sensory processing disorder, if you're not regulated من ناحية الsensory, then it's really hard for you to regulate your emotions. It's really hard for you to communicate. It's really hard for you to work on your activities of daily living. فاللي يصير لأنه they're on the move لأنه they're not regulated. يعني أنا دائما أشرح لأهالي هالمثال إنه imagine if you're going to work وفيكم صداع وبطنكم يعور وألم في اليد وألم في الرجل. Will you be able to focus? واجد صعب. It's the same with them. They're so dysregulated اللي يسوي other things much harder. فنحن usually نحن نشتغل مع speech very closely, sometimes with the psychologist as well. فدائما نفضل إنه we start with occupational therapy sessions. We tackle the sensory لما يكون شوية أهدى شوية more regulated, then we start tackling the other problems one by one. Sometimes we integrate them as well. يعني there are so many, I don't know where to start from. شوفي, some misconceptions are يعني so wide and it's not only parents, it's also therapists. So I'll start with those and then I'll go to the parents. I don't know if that's relevant to you.
Yes.
Yeah? Okay, so a lot of parents a lot of therapists think إنه إذا أنت دلعتي الطفل he will become more severely autistic. There was actually one study done في عمان. I don't remember the specific details, but they tested the doctor's knowledge on the reasons for autism. And unfortunately, so many of them thought that MMR, vaccination, causes autism. It's a very, very common misconception in the ASD world. And MMR, vaccination MMR, which is around 18 months, causes autism. Misconception happened because at 18 months, there is a lot of the child's development, social development, يبدأ يظهر أكثر من motor development. So parents start to notice it more. الشيء الثاني اللي صار إنه في UK حد سوى study he proved إنه MMR has a direct relation. طبعاً صارت ضجة كبيرة وعادوا الدراسات وتقريباً عادوها في 5 دول على الأقل أو even 10 صار ما أتذكر عدد بالضبط بس كلهم شافوا إنه يعني the data could not be replicated. فمعناته ما شافوا هذا الشيء. بعدين بعد مدة بعد ما طلعت هاي الدراسات الفريق اللي كان مع الدكتور الأولاني اكتشف إنه actually اعترفوا إنه هو اللي سوى الداتا وحده هو والكمبيوتر وبعدين later they investigated واكتشفوا إنه it's a fake study.
أوكي.
بس بعد إيش لحد ما صار هذا البروسس واجد انتشر هذا الشيء.
Okay.
Worldwide, a lot of parents refuse to get the children vaccinated because of this. And sometimes in the clinic, we see parents who come in and say, I will not take the vaccination. Oh, and my child became autistic because of the vaccination. Some other parents' misconceptions, and TV causes autism, and you need to not respond to your child, and behavioral intervention. This is parents and therapists, unfortunately. And behavioral intervention is treated sometimes by hitting, less common, more common by ignoring and not validating your child. And research shows actually that you're burning some of the neural connections if you do that. طبعا this research is a bit يعني طبعا more detailed than this. It examined orphans and how unresponsible. Once they're diagnosed with autism, some therapists say behavioral therapy, ignore him, don't respond to him, أو shout at him أو لا تدلعه. And this puts a lot of burden on the parents because once you do that, it's hard. It's your child. وبعدين تحسي أوكي أنا غلطتي لأنه أنا اللي دلعته. أنا اللي I responded to him, which is the opposite of what science is telling us. وبعدين there are some other beliefs إنه dietary changes cause a lot of difference on the spectrum وحليب الإبل you name it يعني literally you name it gluten free كل هاي الأمور. Actually there is some research إنه children who have IBS or they have specific vitamin deficiencies or specific problems gastrointestinal problems. أيوة هذيلا ينفع معهم هذه الأشياء و it shows a difference. And imagine that you're constipated all day, you won't feel comfortable.
Yeah.
And once you get the constipation medication يهدئون شوية لأن تعرفين especially that some of them cannot express فthey're يعني تعبانين حتى يعصبوا أكثر يكونوا much more impulsive. Once you treat that, yes, it helps. بس طبعاً ما في أي evidence إنه other interventions work generalized بدون ما يكون عندهم مشكلة معينة يعني. Okay, early intervention. Early diagnosis, early intervention.
ليش اخترتي هاي النصيحة؟ شو الأشياء اللي الأهالي عم بيغلطوا فيها؟ ليش عم بيصير التأخر إنهم هم ما عم بيروحوا للearly intervention؟
Unfortunately, a lot of parents normalize مثلا social milestone delays, sometimes even motor milestone delays, which is less common with autism, but still sometimes it's there, especially my sensory sensitivities. But early intervention can make all the difference. Although you guys already know, the first 5 years in the child are golden years. The brain is so neuroplastic. The change that can happen is huge and significant. A lot of parents مرات يشكوا إنه something is off, but they say لا ننتظر. Or sometimes it's even peer pressure around them. لا, it's okay, my child talked way later. It's okay, he's communicating at least. It's okay. Sometimes it's a shame. وهذه الأمور الثانية بعد. أول شيء, we are not a rehab center as per se. We are an acute hospital. And I work in 2 clinics. I work in physiotherapy and rehab in an acute hospital, and I work 2 days a week in the developmental clinic in diagnosing and assessing.
Okay.
فلما أشوفهم, our sessions are more educational sessions. I coach them.
Okay.
Rather than هذا, I make sure that they go to the right place where they receive further services. بس أكثر شيئين sensory integration بدون أي يعني مقارنة و something called the early start Denver model. The early start Denver model is an Australian model. They use occupational therapy, speech, psychology, and special education concepts all together. Behavioral interventions, ABA. It's very evidence-based. يعني it's very very structured and it helps mostly مع severe cases اللي يعني these that come in and they just bang their heads or they're just completely zoned out or they have so many sensory difficulties, and I usually try to use them together وهذا الوقت اللي يعني I see even a greater difference. One last addition, it's very nice and you validate the parents' feelings. You spend some time in counseling as well. لأنه so many parents, they come there so overwhelmed. We really make sure to spend time and tell them. يعني أول شيء, it's not your fault. You're not responsible for it. And it's hard. And we know it's hard because it is hard. It's really, 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 really hard. يعني. Many of them have multiple children. It's not only one child, multiple صراحة. It's really يعني when you validate يبدأوا يطلعوا الأوريجينال concerns أصلاً. If you don't validate مرات بس يمشوا. بعمرات if you validate وتقولي أيوة I know this is really hard, you're a working mother and I know this is really difficult. فبتجي تقولش أيوة أنا ما أعرف متى أسوي هذا الشيء. You'll be like, okay, you can incorporate it in the daily routine. It doesn't have to be something fancy or big. You can just spend a minute and do it. فهذا validation, I think it's really important as well. يعني.